Hello, my name is Chloe Burrell, and for my health professions presentation, I will be presenting emergency room nursing as well as military nursing. What is emergency room nursing as well as an ER nurse? ER nurses are quick on their feet, great at decision making, and amazing at multitasking. They are amazing under pressure and know how to work with chaos. They respond and treat patients in the emergency room who require immediate treatment for severe trauma, injury, or medical conditions. Being in a high-speed working environment, ER nurses need to know how to stay collected while identifying resolutions to the many challenges they are faced with. They also need to navigate ways to stabilize each patient while reducing as much discomfort and pain as possible. ER nurses have a list of common roles and responsibilities that they have. Things such as develop appropriate course of actions for stability and balance of patients' needs, treating severe trauma, injuries, and medical conditions, managing medications, blood transfusions, and device placements, accurately and quickly perform all tasks, practice professional nursing code and ethics, as well as prioritize patient care based on need. The location of work for an ER nurse would be in a hospital emergency room. To become an ER nurse, you first have to obtain an ADN or a BSN from an accredited college or university. From there, you take and pass the NCLEX examination, where you will then be a registered nurse and will have the license for it. And from there, you must have at least 2 years of emergency experience as an RN to qualify to take the CEN, which is the Certified Emergency Nurse Exam. This was developed by the Emergency Nurse Association, which was made for certified nurses to be more advanced and knowledgeable in the area of emergency care. When looking at the employment data and outlook of ER nurses, it is definitely a high demand occupation and profession. According to the Bureau of Labor Statistics, it projects a 7% job growth rate estimated for RNs from 2019 to 2029, making a profession such as an ER nurse a very amazing career for people to get into. The average RN or emergency room nurse salary in Massachusetts is $85,000 annually as of the end of October. But the range usually is between anywhere from $70,000 annually to $90,000 annually. But of course, it depends on where you are located for your job, your experience, and your education. It all varies. Now we will get into the military nurse section of my presentation, specifically for the U.S. Air Force Air National Guard. According to the Registered Nursing Organization, military nurses are registered nurses employed by the U.S. Air Force that provide care to military patients as well as military families admitted to specialized military clinics, hospitals, and sometimes pop-up facilities located near dangerous combat zones. The roles and responsibilities of Air Force nurses can be compared to civilian nurses when it comes to treating their patients and following the rules and ethics. Some roles and responsibilities include providing healthcare services, assisting in humanitarian relief efforts, recording patient information, and evaluating the effectiveness of medical treatment. To become a military nurse in the Air National Guard, it has a few more steps than to become an ER nurse in the civilian field. First, you must earn a BSN from an accredited nursing program to become an Air Force registered nurse, because an entry requirement for this program requires that you at least have a BSN. From there, you must pass the NCLEX examination to be a registered nurse. From then, you must enlist in the U.S. Air Force, which you can do with a local recruiter that will help you each step of the way. When you enlist, you must meet the requirements for the United States Armed Forces, such as be a U.S. citizen, meet the physical requirements, and be at least 18 years of age. From there, you must complete the Commissioned Officer Training, also known as OTS. It is a 5.5-week course that combines physical work as well as classroom work. OTS is an officer training school where you will go through 4 phases of training. These 4 phases will be teaching you how to become an amazing leader as well as a fully commissioned officer in the U.S. Air Force, because you must be an officer to be an Air Force nurse. Throughout the 4 phases, you will be focusing on your skills in leadership, discipline, teamwork. You'll be focusing on Air Force culture as well as history, which is very crucial and important. And you will continue to enhance your own personal leadership skills to be the best that you can be. And from there, you will earn your own personal certification of whatever specialty you are specializing in. For example, for me, I would like to complete the CEN because I want to specialize in emergency care. The employment data and outlook for Air Force nurses is just about the same as civilian nurses and ER nurses. When we look back to the U.S. Bureau of Labor Statistics, this projection of 7% is still there for the average nurses, but the salary for the Air Force nurses is fully depending on what your rank is in the military. And it's important to know that because sometimes people can get that confused. But the United States Armed Forces will correlate directly with your current rank. And every single nurse, like I had previously mentioned, serve as officers in the military, which means that your minimum pay will be whatever rank you are currently at. And when you are a new officer, you are automatically put as a second lieutenant. And the list goes second lieutenant, first lieutenant, captain, major, lieutenant colonel, and so on. And I will include resources and references where if you are interested, you can look back and see the list for further ranks. Now I would like to share a very short video of Air Force nurses being interviewed on if they like their profession and what a day in their life is like.
In the Air Force, the nurses and the doctors have to develop a unified front. And I've often heard doctors say, I don't know where I would be without that nurse taking care of my patient when I wasn't there. So that's very important.
We can give our patients anything they want. As in, if we want them to have certain medications, if we want them to have MRIs, CAT scans, x-rays, if we want them to be seen by a specialist, they will get it. Because the Air Force is there for us.
If I were a recruit thinking about coming into the military, and I was thinking about coming into the medical field, I would definitely come into the Air Force. There's just no way around the quality of care the Air Force provides, the educational opportunities that you can seek, and the fact that your job will be secured.
It's a lot nicer than civilian nursing in that we have technicians that can do a lot for us to help us out. Whereas in the civilian world, you might have one tech for an entire unit as big as this unit that I work on. It's a 48-bed unit. We tend to have about 6 techs on duty, and they can start IVs and do blood draws, which the CNAs on the outside are not allowed to do.
The Air Force has helped me grow as a professional and has given me the opportunities to go to school and learn other aspects of my profession so that I can teach others too.
The biggest contribution the Air Force has given me is probably a sense of accomplishment and pride. To this day, I always look up for the Air Force planes when they fly around the city, and I just feel so proud to wear the uniform, the same uniform they do.
I just think that the Air Force takes care of its people better. I think that's just how this service runs. We're people-oriented.
For my references and resources page, I've included not only my cited references from what has allowed me to gather information for this project, but also helpful resources that I think could benefit anyone that wants to find more information about anything that I have just discussed or is interested in any of the 2 professions that I have covered. Here is the next page with a little bit more of the military side, such as the U.S. Air Force Air National Guard Clinical Nurse page and the Society of Air Force Nurses. That concludes my presentation. Thank you.